Well, hello everyone, and welcome to Rising to the Challenge. Thank you so much for joining us. My name is Courtney Granville. It's really an honor and a pleasure to be with you today as your host and facilitator. I have been a longtime supporter of Pelotonia and more recently become a supporter of Cancer Research UK. And so I'm really looking forward to this conversation and looking forward to delving into how both of these incredible organizations are supporting cancer patients and the cancer research community in the UK and the US during the pandemic that we're experiencing. I think I assume that many of you on this call, like me, have been personally affected by cancer. I've lost family members and close friends, and I really deeply feel how devastating a diagnosis can be. I'm also trained as a biomedical researcher, so I have held this bias that research really holds the key to beating cancer and saving lives. And that's really why I think the work that Cancer Research UK and Pelotonia are doing to fund cancer research is so critical, and probably even more critical now than ever. I also believe in the power of collaboration and partnership. And I think the more that we can come together, and the UK and the US can really play leadership roles here, I think the faster our progress will be against the disease. So I'm super delighted to be joined today by the Chief Executive of Cancer Research UK, Michelle Mitchell, and the Chief Executive and President of Pelotonia, Doug Ulman. I get to introduce both of them, and I'll start with Michelle. I'm sure many of you on the call know Michelle. She joined Cancer Research UK from the National Multiple Sclerosis Society at the end of 2018. And until very recently, she was also a non-executive director of NHS England. Since joining Cancer Research UK and taking on the helm of this world's leading charitable funder of cancer research, her focus has really been on collaboration. And she believes that by working together, we can beat cancer. And we also have Doug Ulman. He's not only a friend, but he's the son of 2 cancer survivors and a 2-time cancer survivor himself. I know this really motivates him as he goes day to day to work and oversees the strategic vision for Pelotonia. For those of you who are not familiar, Pelotonia is a US-based not-for-profit that funds innovative cancer research through their grassroots fundraising efforts. And I know that Doug, like Michelle and I, also really believes in the power of a global community and that we can come together to tackle cancer. So welcome both Doug and Michelle to the conversation.
Thank you.
Before we get started, to those of you in the audience, I wanted to just let you know kind of the run of events. We're going to start with a discussion between Michelle and Doug that I'll help facilitate. We really want to focus on how cancer patients and the research community have been impacted by COVID-19 with this lens of being on the 2 sides of the Atlantic. Their organizations have been asked to respond in unique ways, and I'm looking forward to really hearing about how they've been able to do that. And then after about 30 minutes, we're going to open this up for your questions, and I can help facilitate that. You can use the Q&A box that's at the bottom of your screens at any time during the webinar to type your questions, and then I'll get to them during that Q&A session. Or you can raise your hand during the Q&A session and we can call on you live. And just so you know, we think all of your questions are important, so if we can't get to them all, we'll make sure we respond afterwards. But without further ado, let's go ahead and get started. I thought a good place to start, since we have folks from both sides of the Atlantic, maybe we could have each of you, Doug and Michelle, starting with Michelle, tell us a little bit about Cancer Research UK and Pelotonia.
Great, thank you, Courtney, and great to be with you, Doug, as well, and welcome to all of our guests. Well, thank you. Cancer Research UK is the world's largest cancer charity, as you say, Courtney, dedicated to saving lives through research. And to give you a sense of that, we support more than 4,000 researchers, doctors, nurses across a network of institutes, centres, programmes and collaborations focused in the UK, in the US and internationally. The research that we support covers every step of the cancer journey, from bench to bedside and from prevention to diagnosis and treatment. And although our name suggests we are UK focused, we fund almost 50% of all publicly funded cancer research in the UK. We really do have a strong global role in supporting the best talent in the UK and across the world. And to give you just a few examples of why we're very proud of the work of Cancer Research UK over many years, we contributed to developing 8 of the world's top 10 cancer drugs. We focused on the link between tobacco and cancer and stopping cancer as a means to preventing millions of deaths worldwide. We laid the foundations for many of today's radiotherapy and surgery techniques used around the world. And we have trained and supported many of the most distinguished scientists and clinician scientists across the world, focused on cancer research through our graduate and postdoctoral programs at the CRIC and through our academic partners at Cambridge University. And for us, the Cancer Grand Challenge is training whole cohorts of young researchers to tackle problems, not just projects, and to identify and work on the toughest problems in cancer research. And we use our patient and research information to also influence governments, policymakers, funders, and the health system to ensure that research funding is a priority. And we've been extremely focused on preventative public health messages, for example, stopping smoking. We also, and importantly, a resource to and for people with and affected by cancer to provide treatment and support through our nurses helpline and online support for cancer patients, and public information and education on risk factors to help them to make healthier choices. And we do all of this work. We accelerate progress against our mission through research, through influencing, through information, because of the generosity of our supporters and partners who fund all, virtually all of our work in its entirety.
Impressive, I have to say. I mean, I think I've been blown away since I met Cancer Research UK by the breadth of work that you're able to be involved in. Thank you for sharing that.
Thank you.
Yeah.
Yeah, Michelle, thank you. I mean, it's incredible to share this virtual stage with you, and we're inspired by the work that you and your colleagues do. And as you said, it makes it an enormous difference in the UK, but all around the world. And Courtney, thank you for hosting. Thanks to everybody for joining. It's pretty humbling and daunting to try to explain Pelotonia with Courtney as the host, because she and her husband have been instrumental in the growth and success of our organization since its inception 12 years ago. And this organization was really built on the idea that if you brought people together and challenged them to do something aspirational together, they would rally and they would do just that. And that's what we've witnessed. And so we're fortunate that over the last 12 years, we've had hundreds of thousands of people participate in our signature event, which is a 3-day weekend of cycling and philanthropy. And we're really proud that 100% of every dollar we raise is invested directly into groundbreaking innovative cancer research at the James Cancer Hospital and research program at The Ohio State University in Columbus, Ohio. And I know we have several of our partners from the James on this broadcast today. And I also know we have several of our funding partners who underwrite the overhead and administrative expenses so that we can have this 100% commitment to the public, which is an incredible thing to be able to deliver on for the community at large. So I want to thank them for joining as well. The research that we have funded over the last 11 years has really ranged, just like you mentioned, Michelle. It sort of spans the spectrum of the cancer continuum. And just to highlight a few examples of things that we have been very interested in and very focused on, one is funding young scientists, funding people who may be in their 20s, early 30s, who have audacious and grand plans and ideas, but who sometimes don't fit with some of the other more structured, more conservative in some ways, funding mechanisms that exist from other organizations. The other thing we've been really interested in recent years has to do with immuno-oncology. And obviously that is a huge focus for many groups around the world. But just last year, we made a commitment over $100 million to create a new institute called the Pelotonia Institute for Immuno-Oncology, based here in Columbus, Ohio, at Ohio State. And we're really excited about being able to not only deliver on that research commitment, but also the translation of that research into the lives of patients and friends and neighbors of all of us. So those are just two examples. We've funded other larger scale projects. We've funded idea grants, which again are aimed at those sort of audacious, high risk, high reward concepts, and really tried to use the philanthropic dollars that this community has generated to do things a little bit differently. And just proud to be here and honored to have great partners at the James by our side.
Awesome. Thank you both. I mean, I think it's really, really fantastic to hear from both of you about how your organizations are, how you're using your unique approaches and your model to really move the needle and change lives. And I know that for both of you, cancer patients are really at the core of what you do. And they're really what sort of drive you every day, and it's really a shared focus of both organizations. I thought maybe we could talk a little bit today about what you know about how cancer patients have been affected by the COVID-19 crisis, and how you've engaged, and how your different organizations have engaged in sort of helping them through this.
Thanks, Courtney. That's a great question. I think you're right. We share many similar approaches as two organisations, and of course, accelerating progress against our mission is absolutely what drives us. And good question. I mean, cancer patients have been severely impacted by COVID-19. Many are shielding as they're particularly vulnerable to infections, and throughout the cancer care pathway, we've seen here in the UK services significantly impacted, with cancer screening being paused, delays in diagnosis and treatment, for example. And we have quite a significant backlog of people who are eager to get their services and support that they need. We've also have resources on our website for patients about coronavirus and cancer, and have a dedicated team of nurses who run a helpline for anyone worried about cancer. But to give you a sense of the scale of some of the issues we're facing, urgent referrals dropped to around 25% of usual levels in England at the start of the pandemic. They have started to rebound a little, with figures at around 50% of usual levels in recent weeks, but for each week referrals stay below 100%, the number of cancer cases that are going undiagnosed will continue to stack up. And as you can imagine, that is a significant worry. I mean, we estimate a backlog, wait for it, a backlog of 2 million people waiting for cancer screening, tests and treatment, all of which we know will have a significant impact on patients and we fear it will have a significant impact on some people's survival too. Any delays to diagnosis and treatment could mean that some cancers will become inoperable, more progressed and harder to treat. So we estimate for every week that screening is paused, 7,000 people aren't being referred for further tests, and 380 cancers aren't being diagnosed through screening programs. So you can imagine people have been very concerned about COVID, but we're equally concerned about cancer, and cancer doesn't stop during a pandemic. And so our focus has also been about ensuring that cancer services are restored, and the NHS and the government puts cancer at the top of its health agenda as soon as possible.
I think you raise a really interesting point in that, you know, we've worked so hard collectively, tons of organizations around the world and public health officials to communicate the significance and importance of screening. and changing people's behaviors and making people prioritize those screenings and diagnostics. And any issue that interferes with that could cause people to just choose not to seek out those screenings even when they're available. And so there's the sort of psychologic impact as well. I know as a survivor myself, I actually put off my 6-month checkup in May because I just felt like, it's not worth the risk right now. And I thought to myself, gosh, if I'm doing that, what is somebody else who may not have ever had cancer or experienced the healthcare system doing? And I think it's remarkable, all the services you're providing. I think the way we've seen this impact is, one, our partners at Ohio State have really gone above and beyond to create new programs, new processes, new ways of supporting patients, because everything has changed. And I think about it in 3 buckets: the sort of practical side, which is things like, not being able to have family members with you, during treatment, which is now shifted here and has been relaxed a little bit. But imagine being diagnosed with cancer and not being able to have a family member with you, during your first treatment. And I understand why that has to happen, and it's the right thing for the public health journey that we're all on together. And then secondly, I think of the psychosocial impact. I mean, a cancer diagnosis is incredibly overwhelming and scary, and you're filled with all of these emotions, and layering in everything else that's going on in the world from a stress and anxiety perspective is just another burden to carry with the diagnosis. So you sort of have, the sort of practical and the psychosocial, and then you have the physical, as you mentioned. I mean, the higher risk. So compromised immune system, but also just the exposure to having to go to radiation therapy or having to go to chemotherapy and having to interface with more and more people. So the combination of all of that, I think, is very worrisome. And as somebody who's been in this field for 20 years, I think there's no more critical time than right now to sort of double down on our support for patients, for survivors, for their families, and for research. Because the money invested today will have a greater impact potentially than money that was invested 5 years ago or 10 years ago, given the urgency of the need.
Yeah, that's a really good point, Doug. I mean, many of the people I've spoken to with cancer talk about their confidence getting a bit lower during this period, perhaps feeling a little bit more anxious, and turning to family and friends for support where that's been possible. So we've tried really hard through our helpline, which has never been used as much as it has been over the last 3 or 4 months, to be that support, to be that listening ear, to give the information, to help navigate through this very complicated period. But also we published today, it was today or yesterday, gosh, the days are going quickly, with 25 cancer charities, our 12-point plan for cancer services as well. And at the heart of that plan is a clear message to government and the NHS about what's needed to get us back on track to achieve those big ambitious goals we have about improving cancer survival here in the UK. And we do lag behind a number of countries around the world in terms of survival. So they were stretched before COVID and need significant attention now as hopefully we come out of this period. But we also appreciate that there are a number of things that need to be put in place, ensuring COVID-free hubs and centres are available, that there's testing is a big issue here in the UK, that there's capacity and resource put into diagnostics. And as you say, Doug, making sure there's public health messages and information to address the anxieties of people, ensure that if you've got signs and symptoms, come forward, because we don't want to leave it. One day an extra day is one day too many. So we're galvanizing our support and our communities to ensure that COVID has the least impact it possibly can, but we know we face a big challenge. And on the point of what are some of the good things that have come out of it, a bit like Dickens, isn't it? We live in the best of times, the worst of times, for the literature fans on the webinar. There are many things, and we might come on to it later, about how we've learned to do things differently, better, quicker, and how our health system is responding well in parts also. So maybe we'll talk a bit about that later.
I love to hear that optimism, and I do agree with both of you. It's worrisome. I mean, the news reports, I think, are increasing now over the last couple of weeks around this issue of patients and their I guess comfort in accessing care. I think there are also a lot of news stories in other areas that are important in the cancer community, and I thought maybe we could talk a little bit about some of the stories that are out there, some of the myths that might be out there around the impact of COVID on research, clinical trials, and cancer treatment. And I think there may be some similarities and difference, but I thought maybe we could talk about those three areas. So just to kind of flesh that out a little bit, I know I'm interested in hearing about, what's really happening on the ground with respect to research and how the research community has been affected. And what it means for research more broadly going forward, since I know that's really at the core of what both organizations do. And then, from bench to bedside, what's happening with clinical trials and the impact. I know there was a lot of talk of them, of pauses and slowdowns with respect to clinical trials. And is that still what's happening now? Is that, really what's going on? And then the backlog of cancer treatments at CRUK, Michelle, you guys have been very vocal about the backlog in treatments. And so maybe you could touch a little more on that. And I'm not sure how that's playing out in the US either, but I think we may have seen some of that in the news this week. So I know that's a lot.
Yeah, well, I'm really curious.
Pick and choose on what you want to touch on.
Yeah, sure. Doug, do you want to go or do you want me to
go?
I'll
just briefly say, look, I'm really curious to hear what your experience has been. I think one of the challenges in all of this is that as it relates to COVID-19 and the impact of the pandemic, there's just so much information out there in the media, and it's changing so rapidly, and it can create a false narrative sometimes. And so, Courtney, to your first question, we had an instance a few weeks ago, it may have been months now, I don't know, where somebody said, oh, well, I heard that they've stopped all cancer treatment, and that's not the reality, right? So anyone that needed cancer care at the James and at Ohio State was getting state-of-the-art cancer therapy. I think, as we talked earlier, the biggest issue was people not having their sort of checkups or their screenings or their sort of being seen for symptoms, which if we don't know about, we can't obviously reach those individuals. From a research perspective, I think a lot of it in the US at least had to do with the geographic location and sort of what was going on with the pandemic at any time, which dictated whether labs were remaining open or whether labs were closed, et cetera. And that has been sort of a rolling journey or calendar. But the one thing I would say that we've experienced here is that there have been so many people in the cancer research enterprise who have been actively involved in projects related to COVID-19, whether it's plasma-related projects, whether it's looking at approved cancer drugs and whether they might have an impact. So the sort of, the enterprise, I don't think stopped. Were there less accruals to clinical trials? Were some trials probably delayed? Of course. But I want to make sure that people know that for the vast majority of people who needed their cancer therapy, they're receiving that and continue to receive that, and there was no delay in those individuals' care.
So thanks. A couple of things, starting with research. Our research labs are just now getting back up and running. So in March, many researchers in the middle of experiments and clinical trials that, due to lockdown, have been made invalid because they needed to be halted. For some of our researchers, they've found similarities in basic research and between cancer and infectious disease, specifically viral cancer. So some have been able to pivot to new research activities. focused on the underlying understanding of COVID-19, testing for antibodies and treatments. We have also launched a clinical trial to test if a drug that's being used to treat inflammation of the pancreas can help with COVID-19. This is something called the Spike-1 trial, funded by LifeArc, is a partnership between the CRUK Centre for Drug Development, Lattice Therapeutics and the University of Edinburgh to investigate whether an identified drug called Camostat could help control symptoms of the virus and prevent people that are infected needing to go to hospital. But we've also seen from our research community an overwhelmingly positive response to help to share PPE and to pivot any transferable or relatable research to help the global COVID cause. I think we feel quite strongly we want to defeat COVID and get on to defeating and beating cancer as quickly as possible. And Courtney, you mentioned, I think you spoke about from bench to bedside, what's the impact on clinical trials. Unfortunately, many clinical trials have had to pause and recruitment has had to stop. This can be especially worrying. I mean, especially worrying for someone who have a later stage diagnosis. Of course, but I want to reassure our community that not all clinical trials have stopped, and our plan is to ramp up clinical trials as soon as possible. And if people are particularly interested in that issue, we've got a great blog on our website. We perhaps can include it in any follow-up to this. And I've already touched upon, the backlog that we are seeing here in the UK. It is significant. We do need government to come up with our support. We're influencing them very heavily, a plan to get not only cancer services and treatment back on track, but an ambitious plan to ensure that we keep on making progress against the big ambition we have to improve survival. That won't happen without investment in diagnostics, increased numbers of people working on cancer in the NHS, and also ensuring that cancer research is protected and is supported through this period. You did say, Doug, not all cancer treatments have stopped, and I think that's really important to reiterate that. That's the same here in the UK. And so to give you an example, it's been an opportunity for us to evaluate how and where treatments are administered. So for example, being able to take chemotherapy tablets from the comfort of your own home, or especially more virtual appointments with clinical teams, and we've seen the NHS just recently announce accelerating the rollout on advanced radiotherapy treatment. So my hope with all of this is, we talked about some of those things for years. It's been amazing what we've been able to do in 3 months, that we continue to innovate and continue to speed up the progress that we can make for people with cancer, and take the opportunities that are available before us to do things better, quicker, and hopefully cheaper.
Yeah,
I think that's the most exciting thing from all of this that we're seeing, is just the expediting of things that were bound to happen eventually that have just been prioritized. And whether that's telehealth, I mean, our partners have at the James have done tens of thousands of telehealth visits just in a few short months, when it went from basically 0 to thousands. And in fact, last week they launched a new cancer diagnostics program, which is going to be have multiple locations out in the community. And it's going to help facilitate those screenings and hopefully those sort of early detections in a much simpler way, where people don't need to go to the main hospital or the main campus, or sort of be sort of overburdened by the vastness of that experience. And so we're hopeful that coming out of this, there will be more and more things that are happening more quickly than they would have otherwise.
One friend who has cancer said, and I don't know why I would wish to sit in a dirty, drafty hospital corridor in Sunderland again. You know, I want it done from the my living room. So yeah, no, there's lots in it, isn't there, for us to learn from and to change.
It's really heartening to hear you guys both be very optimistic about the impact of COVID. I mean, I think that I had heard a webinar on the impact of COVID on healthcare, and the gentleman who spoke talked about the COVID as a catalyst, the COVID catalyst towards really making some of these changes, as you both said, things that were already coming down the pipe, or that we were all kind of working towards, but maybe more slowly, and that this has really given us the opportunity to do some things that might really make sense for patients. So I agree.
Courtney, I think one of the other things that I think is important, and we are trying to communicate this message in a way that's not, that doesn't sound arrogant or self-serving necessarily, but the reality is many breakthroughs over the course of history in biomedical research were grounded in cancer discoveries. Mm-hmm. And so the cancer research enterprise, at least in the United States, has, and I'm sure in Europe, has provided so much value to things that are non-cancer as well, whether it was HIV/AIDS, whether it's happening now with the coronavirus. I mean, so an investment in cancer research is great for the cancer enterprise and cancer patients and their loved ones, but it also has a bigger benefit. And I think it's important to let people know that they're investing in cancer, but that the value and the long-term benefit we may not even see yet.
Yep. Yeah, I think that's a really good point. And thank you for bringing it up. I want to take the opportunity to pivot. We've got about 5 minutes before we go to live questions, and I
does that mean be shorter in your answers?
Yeah, no. Well, this is your last chance to not really. I think we've got plenty of time, but I did want to let those on that have dialed in or on the video know that they should go ahead and start submitting their questions, because we're going to start to get to those. But I also thought this was a time we could pivot a little bit, because and you've alluded to this, both of you, in some of your previous comments. You've really had to pivot yourselves as organizations and been asked to step up in unique ways because of the pandemic and COVID-19. And some of the things you've been asked to do have been outside of your day-to-day mission. So I wondered if you might take a little bit of time just to talk about some of the things that you've engaged in, and maybe why you've decided to do that, even if it's not necessarily spot on with your mission.
Well, for us, scientific breakthroughs and new discoveries benefit the world. They don't just benefit London, the UK, Europe. I mean, we're all global citizens, and we all benefit from that endeavour. We've pivoted our research where possible to support the national and global COVID efforts. Some of our institutes have been repurposed into testing facilities, for example, the CRIC in London, and we've provided equipment for hospitals. We've helped fund the development of vaccines. Dr. Parker at Cardiff University is drawing on his knowledge to make cancer vaccines in an attempt to develop a vaccine for COVID. Researchers from Cancer Research UK, Newcastle Drug Discovery Unit are trying to identify new cancer drugs to discover the potential new drugs against COVID-19. We've had in Manchester, our institute has been using 3D printing to make PPE equipment. And I suppose at the heart of this is it's simple. Cancer is a global problem for all us across the world. I think for us with Pelotonia, 2 organisations sharing a similar mission and cause, our voice is stronger and louder together, and working together can only strengthen our ambitions and realise our ambitions. And we see the benefit of bringing together, the power of bringing together expertise from across the world through our Cancer Grand Challenge initiative, a partnership with scientists, organisations and philanthropists who share our mission of accelerating progress and beating cancer together, but believe we will accelerate that progress through collaboration, bringing the best and the brightest together on some of the toughest questions we face. So particularly in relation to COVID, there are some examples of why we are engaged, why we take a global outlook, and why we, quite optimistic about the future and the power of collaboration to accelerate progress against our mission.
I think you said it best when you said we're all global citizens. I mean, none of us would have anticipated 6 months ago that we would be in this current environment, and the speed at which we're all forced to navigate and change course has been pretty remarkable. I think for us, very similarly to you, we felt like we have been the recipient of so much generosity and so much community engagement over so many years that this provided a great chance for us to give back in new ways. So whether that was creating a research fund and seeding with a pledge of $1 million for COVID cancer-related research, or whether that was, earmarking the profits from our merchandise sales to feed frontline healthcare workers and support them as they are supporting all of us. All of these things were not even on our radar 6 months ago. And I would add that in addition to COVID-19, we are now dealing with a major discussion and action related to social justice and equality. And that has provided yet another opportunity for us to rethink what we do and how we do it. And cancer is not immune. I mean, there are tremendous cancer health disparities that exist. And the mortality rates for African Americans, as an example, are significantly higher. And it's unconscionable that we would allow that to continue. And so I think all of us are reevaluating how do we invest in scientists of color? How do we make sure we're delivering programs to people who need them the most? And so we've sort of had two significant challenges that have arisen or been brought to the consciousness of the world at the same time. And I think it's incumbent upon all of us to really assess who we are and what we do and how we do it to impact the world in the most positive way.
Yeah, thank you for bringing that up, Doug. I mean, I think it's a good point that, not only has COVID-19 sort of brought forth some of the issues that we have in terms of just responding broadly to cancer patients and care and diagnosis, but the disparities are a big issue, I think, on both sides of the Atlantic, and important for us to continue to focus on. I still have some more questions that I want to ask you, but we also
shorter responses this time.
Well, we also have some questions that are coming in from the audience. So what I thought I might do is start with some of their questions and maybe then go back and sprinkle in some of my own, just to see where that takes us.
Sure.
Okay, yeah. Okay. So we do have a question from Daniel Hockman, and Daniel's asking how we're going to catch up if there are 2 million patients on the waiting list. And how we'll ever treat the new patients. So I think, Michelle, that's probably geared mostly towards you.
Yeah, I mean, I would reiterate the point I made earlier. We need a national plan. We've published our own 12-point plan today with 25 cancer charities, which is a good guide for the government and the NHS across the United Kingdom. We absolutely need to see COVID-free spaces continue. We need a ramp up in testing to make the new treatments possible. We need investment in diagnostics. Workforce is critical, and a big emphasis on public health information and campaign to encourage people to come forward. So we've laid out the key elements and we'll be pushing hard. Both the Prime Minister here is due to make a fiscal statement in July, and there's a big spending review, which is when money's allocated to ensure that cancer remains a priority. But we do have a long way to go. But we mustn't step back from our ambition mission to improve cancer survival here in the UK and around the world. Our job working alongside people with cancer, cancer charities, the Royal Colleges, our researchers, our clinicians, our scientists, is to ensure that we as the strongest team collaborate to come up with the solutions to make sure we make progress, and that's exactly what we're doing at the moment.
Yeah. I mean, I think the advocacy efforts are going to be really critical. Michelle, I really applaud Cancer Research UK for all that you've been doing. I've seen some of the submissions that you've made to the NHS and others, and I think that's going to be really critical. And I just wonder, in my own mind, I mean, you both have spoke about some of the sort of the innovation and some of the result of Cancer Catalyst, and I think I'm an eternal optimist as well. And I just wonder, you know, I'm hopeful that some of these changes and innovations that are happening will help us get back on track and help us get where we need to be. So I don't know. I think time will tell, but
well, Courtney, I think you know, yes, there are many. I mean, we've had to think very creatively about our fundraising, and we've been challenging our supporters to keep fit and well, running 5Ks or 10Ks or even the marathon from home when social distancing allows. Have been putting on lots of, you know, race for home, race for life at home. We've seen great innovation in the health service around telehealth and virtual support from health teams and also GPs. I think we've deepened our relationship. This has been a great opportunity to engage our supporters, our partners, our philanthropists in our mission and cause. And so there are so many ways I'm positive the way in which the scientific community has responded, rallied around the COVID-19 effort, but also positive around the cancer global community coming together with confidence. And you know, particularly our Cancer Grand Challenge program is a flagship program for us. But I would say there are some downsides. I mean, you know, I am an optimistic, but my name isn't Pollyanna. We have we're facing one of the most serious, well, I would argue this most serious crisis as Cancer Research UK in our history. In this year alone, we were expecting to see a £150 million drop in our income. And of course, that creates significant pressure. And we're uncertain about the 2 years ahead as well, about what the future might hold. And so we're very worried about the impact that drop in fundraising could have on our ability to fund cancer research. And so now more than ever, we need our supporters who have always stood by us, our partners, philanthropists who believe in our mission, and also we believe it's time government helped out in these unusual circumstances, because what we don't want to do is you know, devastate cancer research here in the UK or reduce our funding significantly. So we're asking our supporters to stand with us during this period. Cancer doesn't stop during COVID, and we need our partners more than ever.
Yeah, absolutely. And Michelle, thank you for bringing that up, because I think that's a nice segue for both of you to ask you about some of the tough decisions that you've had to make because of the drop in income. And I'd be interested in hearing about what that means for both of the organizations, and then also, you know, how you're looking to continue fundraising today and in the current climate.
Yeah, I mean, I think Michelle said it best. You know, there are some real positive things, but there's some real uncertainties. And I think the economic impact of this pandemic is yet to be fully appreciated, and the duration of that is ill-defined. So, you know, I think there's the immediate needs, and then there's the thinking sort of longer term. You know, we've been very fortunate that many of our supporters have really stepped up. Our funding partners have recommitted and sort of said, hey, we're in, and we want to make sure that you not only weather this period, but you thrive into the future. I think so much of our fundraising is peer-to-peer. It's people going out in their community asking their friends and neighbors and colleagues and families to support them. And I think what we're seeing there is a reticence to figure out the best way to ask. And people are just nervous. They're overwhelmed with what's going on from a COVID perspective or a social justice perspective. They're figuring out what they're going to do with their kids during the summer. They're figuring out when they're going to go back to their offices. There's just a lot going on in people's lives, and sort of cutting through that to emphasize everything that we're talking about today and the significance of research at this moment is challenging. So I think for our team, we made this big pivot to say, look, we know we're not able to have our 3-day mass physical event with tens of thousands of people standing shoulder to shoulder. And we created something called My Pelotonia. And that's a way for people to define their engagement. And the one thing I would mention about that is that that's not just for 2020. We are building that in a way that will continue on. This is not a one-year sort of endeavor for us. And while the fundraising is hard to predict, and we will realize these challenges in some way, I think our focus is really on engagement. How can we just continue to engage more and more people, even if financially, from a fundraising perspective, there's a negative impact in the short run, because I believe strongly in those relationships. And I know there was a question asked about how we had raised so much money in 12 years. And it's really a testament to the community and a testament to people caring about the mission, but also wanting to do something together to make an impact on the world. And the more people we can attract to our shared cause in the long run, my opinion is that the fundraising will take care of itself. And so those relationships, that engagement, the communication, things like this, I think are absolutely paramount during this time of uncertainty.
Thanks, Courtney. A couple of points from me. Some of the immediate steps we have taken. I mean, very sadly and regrettably, we made an immediate £44 million cut to our research budget. We have all of our staff working 80% at the moment for 80% pay. 60% of our staff are furloughed. Our executive team has taken a pay cut. And we are naturally watching every single penny that we spend during these uncertain times, because we want to protect research. I mean, that's absolutely what we want to do. In the response to COVID and the recovery and the rebuild, we're really confident, actually. I mean, I think we have a cause which all of us share deeply. We have world-class research, some of the brightest and the best we fund. And we, like you, Doug, believe engagement is absolutely critical, but we, with our supporters, our partners, philanthropists, and that long-term relationship is critical. And I'm sure we will come back even stronger than where we entered COVID in time. But we do face some tough challenges and some tough decisions ahead. But I think our job, as leaders, is to define who we will be in the future, not who we were yesterday. And we have a great opportunity to define Cancer Research UK for tomorrow, not yesterday, and we'll do exactly that.
Yeah,
I love that. That's awesome.
Yeah, really amazing. I think what both of you are doing to keep people engaged is inspirational. And I think I would take a question here from James Loosley. He's asking about the CGC initiative. I think that's the Cancer Grand Challenges initiative. He's asking about why that's an important initiative, why it's needed, and what makes it different. I know, Michelle, you touched on the Grand Challenges a little bit, but how's it different from your other funding opportunities? And what's it enabling that wouldn't otherwise happen?
So Cancer Grand Challenge is a really important initiative for us. It's a large-scale research program. Some of the awards are 20 million plus, and we're agnostic about where we fund them in the world. So we want to fund the best and the brightest scientific leaders wherever they are, bringing teams together from across a number of countries to explore and tackle some of the most audacious, most difficult questions in cancer research. And we do this because we believe cancer doesn't no boundaries. Therefore, we don't believe in boundaries. We want the best and the brightest in the world to tackle these big, big problems. And that's because we're also global in our outlook. Although we fund significantly in the UK, we're global in our outlook. And as Doug was saying earlier, we want to be able to give these brilliant people the opportunity, the space, the freedom to direct their work, to ensure that they are exploring with a high risk, high return mentality without significant limitations, how they can break down the barriers in cancer research. So we're delighted to fund a number of projects across the world and would continue to do so in the future, because we believe it is through that global scientific platform, it is through building a whole new cohort of the best and the brightest who know no boundaries, who aren't thinking about a country, they're thinking about beating cancer. That is a way in which we believe we can have a huge impact on the world.
Yeah. And I know from being fortunate to attend your symposium just for a day this past winter. I mean, I was really struck by the ecosystem that's being built through the Grand Challenge initiative. And the fact that you're really engaging trainees and fellows in a new way, and that they're learning from the very beginning of their training and their research careers to work globally and to cross these boundaries, I think.
And to work in a multidisciplinary way, cross boundaries, and also have excellent leadership and mentorship from some of the best scientific leaders in the world who are doing the most fantastic work, and that's relatively new. It's not something that we have spent decades doing, but I think it's an important reflection of how we see ourselves in the world, the fact that we want to work the best and the brightest, and we see this as a global endeavor, and are keen to partner with others to ensure that we can continue to fund and accelerate progress in this way.
Yep, thank you. Our next question is from Stuart Mason Elliott. Doug, I think this is directed at you. He's asking about Pelotonia and how many participants we have and what your secret sauce is. He runs a 3-day charity cycling challenge in the UK. His organization is called Challenge Adventure Charities. And they've raised a staggering $4.5 million since 1996, and they have a similar 100% model. So he's curious to know how we've gotten over 20 million in 12 years.
Well, Stuart, first, congratulations on your success. It's remarkable. We have been so fortunate to have the participation of thousands and thousands of people. So. On any given year, we have between 7,000 and 8,000 riders. We have about 3,000 volunteers for the 3-day weekend. And then we have several thousand virtual participants or virtual riders. And each of our participants commits to raise a certain minimum amount of money. And so we have been really, really fortunate to see this community really engage. And I think one of the, two interesting things about our model. One is that so much of the participation and fundraising is driven by pelotons or teams. And those teams can be community organizations. They can be formed to honor a loved one who is surviving or who has passed, or they can be corporate in nature. And having all of those various types of teams participate and compete a little bit with one another has definitely driven a lot of the fundraising impact. The other nuance that I would share is that our partners at the James and Ohio State years and years ago came up with the idea that if you were to receive funding from Pelotonia, from any of our funding mechanisms for research, that you should participate in the ride. And it has created an environment whereby you are literally shoulder to shoulder or riding next to people who are doing the work that you're fueling. And they're not just doing the research, but they're doing the fundraising as well, and they're doing the physical activity with you. And it's really broken down this barrier that I think has existed for a long time of, oh, well, the research is done over there in that building somewhere, and I don't really get to feel it or touch it or understand it. And I know we have, Zihai Lee is listening to this call right now. He's the director of the Pelotonia Institute for Immuno-Oncology. And, when he first came to Columbus, Ohio to lead this new institute last year, I said to him, when's the last time you rode your bike? And he said, well, it's been a few years. But this year for his Pelotonia, he's riding 20 miles every day for 20 straight days leading up to when the event would have happened. And I say that as an example because he's inspiring other people to say, hey, I'm a researcher, I'm an immunologist, I'm a clinician, I'm leading this institute, but I'm also one of you. I'm a member of this community who cares about this cause. And to the question that Stuart raised, it's just created a bond between the researchers and the advocates and supporters and fundraisers that is really special and significant.
I agree. I mean, it's similarly here in the UK, and that good old feminist phrase, the personal is political. We're all part of this together, aren't we? Whatever your background is, and we feel this strongly in the UK. We have scientists fundraising, clinicians fundraising, nurses fundraising for us, but we also have volunteers in their 80s volunteering in our shops. We have people giving a small amount of their time or a large amount of their time to do many events for us and encourage their family and friends to support them. And also very generous people who are on very modest incomes give to us every single month, because I think they see, as we do, that our mission and our cause is bigger than any one of us. And no one person, however many Nobel Prizes you may have, is going to beat cancer alone. And our strength comes through the team, through the collaboration, and each of us making the best contribution we can, because none of us want to see, as we've talked about, our family and friends. We just don't want to see them die of cancer. We don't want to see them have cancer. So it's such a personal motivation, I think, for so many people, regardless of what you can bring to the table and what level you bring to the table as well.
Yeah, I agree. And it's been very empowering and inspiring for me to ride alongside the researchers or run alongside them, as I have in the UK during the winter run. That's my event.
It's a bit chilly though, isn't it? That run, I've done that run. Yeah,
it keeps me fit during the winter.
Yeah.
I do want to have time for one last question, but we only have a few minutes. This is from Jeffrey Silkstone. Jeffrey, did you want to ask your question live? I'm not sure we can hear you, Jeffrey, so I'm going to go ahead and ask your question. He asks, should we be doing more to bring cancer and its symptoms to the attention of the general public?
So I think now more than ever, given people's lack of confidence and apprehension about coming forward with signs and symptoms, it is essential. Public health campaigning is part of not only what we do as charities, but also that our NHS and our government invests in public health campaigning. We have to raise awareness of signs and symptoms and ensure and encourage people come forward so they are diagnosed as early as possible.
Yeah, I agree. I mean, look, we know that research takes time, but the immediate impact that we can have is screening more people as early as possible and making sure they're diagnosed. Should they be diagnosed, they're found early. I think one of the things we've seen through Pelotonia, which relates to this, is that the nature of physical activity and people exercising has them more in tune with their body. And nearly every event we've ever had, in the immediate aftermath, people have said, you know what, that was a reminder for me to go get screened. I was out there riding, I was participating, I heard a survivor tell their story, I heard a researcher explain what they were working on, and that was my signal to sort of get screened. And so I think the storytelling behind those messages can be really powerful. I think sometimes in public health, we have fallen back on sort of more academic messaging as opposed to sharing the stories of people who were detected early and who have great success to share. And I think that's important.
Yeah. Thank you both. And thank you, Jeffrey, for that question, because I do think that's a really important message as we're all kind of hearing different things in the press and unsure about what we should do. Having trained in cancer prevention myself, I know the number one thing you can do to help yourself is make that phone call if it's telehealth right now, or get into the doctor's office if you are feeling not like yourself. So thank you for asking that. I'm sorry that we're at the end of our time. This has been a really, really interesting discussion for me to be a part of. And I hope really inspiring for everybody else. But we're at the end of our time. So thank you, Michelle and Doug. Thank you for everyone who asked questions and for your interest in our webinar. I know there are a few questions still out there, so I want to assure you we're going to get back to you. But thank you for this honor. I really enjoyed hosting today. And I think despite the challenges, it's clear that both Cancer Research UK and Pelotonia are doing everything they can to continue to drive and fight and rise to the challenge and to do this together. So thank you so much. It's really been incredible to hear about all of this, and I look forward to talking to you again soon.
Thank you.